diagnosis of the pregnancy, which those days did not practice. The role of dye started when the labor pain started. Now we started stressing that whenever you know that the lady is pregnant, you need to go to her and give her advice regarding the diet, regarding the vaccination, regarding the risk factors of the pregnancy.
Is there a swelling on your legs? No. Do you have headaches? How many months are you pregnant? Are you sure? Did you have a blood test? Have you taken a tetanus injection?
Then we arranged diet plan for the dye depending on the sources available at the site. So initial first or second day we used to talk to them informally what sort of food they have, what are the sources available in their area, and on fourth or fifth day our advice would be charted according to the sources available. Saying that you always have to have green leafy vegetables did not work in this area. Then we said we need to get associated with the government machinery. The problem was with implementation also. The staff was there. They were made aware of the facts that there are nurse midwives employed by the government. Those will be coming to your help. So supply of the ferrous sulfate iron supplement, then vaccination for tetanus, getting a proper weight, in between antenatal checkup by the trained nurse. These factors were stressed so that the dye got associated with the government machinery. This improved antenatal care. This improved the bond of the dye with the government healthcare delivery system. This reflected on the hygienic condition of the PADA also, because now the government staff also started taking more interest in that. So we decided to stress on the hygienic measures. The cleanliness, you need to wash the hands frequently, use of the soap, use of the nail cutter we taught each and every day. One nail cutter was given to each trainee and it was demonstrated how to use it. The importance of proper nail cutting. From that we started demonstration of the soap, how to use the plastic, giving the dye kit, making them familiar with the use of the dye kit under the supervision of the trained nurses who were conducting deliveries at the municipal hospital. Because we felt that more than theory teaching, what was more important was demonstrating how to conduct the delivery. Then pediatricians were involved. Those talked about the neonatal stress, how to identify the risk baby, how to resuscitate the risk baby with the available measures, when to rush baby to the hospital or primary health care center, and how important is the vaccination.
At the camp, the midwives also gain instruction in post-natal care. Look after the baby when it's born. This is how its head must be washed. Remember to support the baby's head like this. After that, wash the baby's face. Clean the mucus. Use warm water to bathe the baby. Next, tie a string around the umbilical cord. See that you don't stretch the umbilical cord too far from the navel. Now, we are going to weigh the baby. Don't toss the baby into the weighing scales. Place it gently. Then, slowly slide your hand away like this. Can you see the red needle? Where is it pointing? After learning about the modern practices of delivery, women talk openly about their own traditional practices in detail. The midwives spell out how they traditionally conduct a delivery. First, the pregnant woman is made to sit close to a stump or pole and clasp it tightly. Next, a few village women gather close to help in the delivery. First, they form a ring around the woman who is going into labor. One of the women applies pressure on the patient's stomach. Together, the dyes coax the pregnant woman to push out the baby. No matter how much the mother screams, the midwives continue to hold her in that position. We do that to help the baby, they inform. After the delivery, they try to pull the placenta out and later bury it in the backyard. What do the midwives do after the baby is born? The process is best described in the words of the tribal dais themselves. While the woman is waiting to deliver her baby, ash is spread out on the ground in front of her. The ash is made from burning cow dung cakes and wild grass. As soon as the baby is born, it is placed on this bed of ash. The mother keeps sitting in the same position, pushing outwards. To help her push out the placenta, what is done is that the woman's hair are kept all loose even before she sits for the delivery. Then, after the baby is born, the midwife, who is putting pressure on her stomach, pushes a handful of hair into the mother's mouth. She feels very nauseous, and that sensation of vomiting does the job. It forces the placenta out.
So it was really shocking to know that they were not knowing the placenta falls on its own. And when it was further inquired into the matter, it was revealed that since they were not knowing that placenta falls its own, immediately after baby comes out, they used to plug the placenta. And in the process, obviously, the uterus used to be everted, and probably that could have been the major cause of the bleeding.
After the placenta has fallen out, a couple of the village women help the mother to get up and seat her on a stone. Then she is given a hot water bath. Later, the midwife prepares a traditional disinfectant bandage. This is made by selecting a large leaf of the ruchkin tree, which resembles a banyan tree leaf, and applying a paste of salt and turmeric on one side. After her bath, the mother is made to sit in a comfortable position. The treated ruchkin leaf is now pressed into her vagina. It is firmly held in place by tying a diaper around it made of soft material. Of course, the woman cries out in pain for about 5 to 6 hours. But the paste acts as an antiseptic. After a few hours, the wound is on the way to healing. Traditionally, after birth, the child is not fed anything at least for 2 days. In the majority of cases, the mother starts going to work within 2 or 3 days of delivery. For the mother, they prepare a porridge-like dish as a special food, which is in fact not very nutritious. Now, after training the dais, these practices are changing.
With Dr. Solpure's training program, we have trained 55 midwives who were educated but not having any experience, which is now stopped because Dr. Solpure is transferred. But Vanvasi Kalyan Ashram, they have trained more than 150 so far. So together, we have trained more than 205 midwives in the last 2 years. And by the time the project will come to an end in year 2001, we should have trained more than 300 midwives. But it will still leave another 700 untrained.
The 15-day training is seen as only one part of the whole DAI training program, as a basic stepping stone. Then what comes ahead is the follow-up. Because unless follow-up is there, we cannot know whether they are practicing the way we have taught, any difficulties they are coming across, any problem with the social acceptance they are coming across. So we have planned for a periphery visits. We do visit with our worker and preferably at least one doctor to the site where the lady works. We have arranged them in groups, monthly meetings are being planned, and a team of doctors from Dhule visits, say every third month or every fourth month as per the convenience.
Initially, we are going to build a hostel for these midwife trainees. Then we decided to have our own hospital so that we don't depend on others for the hospital facility. And the idea of hospital also had another angle to it, because we can get some income from the hospital, and that will keep the project running even after the external funding has come to an end. So basically, what K.S. Pandey Memorial Trust is planning is to have a permanent institute for this purpose, and they are thinking of establishing Institute for Healthcare Training. And if we get this institute going with the help of the hospital, we should be able to train not only these tribal midwives, but also nursing assistants on a short course basis for 6 months or 1 year course. It will improve the health of these tribal people in our district. In these two districts at present, the percentage of tribal people is close to 49%, and it is the largest tribal district in Maharashtra state.
Today, trained DAIs are more respected than before.
And now, the dream has come true. The new well-equipped hospital is inaugurated at the hands of eminent doctor and social worker Dr. Prakash Amte in the presence of well-known surgeon Dr. Neetu Mandke.
आणि त्यासाठी प्रकाश आमटेंसारखा आदिवासी सेवक, नीतू मांडकेंसारखे हृदयशल्य विशारद आज आपल्याला लाभले आहेत.
Tribal people observe that with the trained DAIs, better health and hygiene has entered the paras.
And the DAI will look as one person where the whole pada looks at her with the hope for any solution for any problem. Because she is in touch with the people who are in the city, she is active worker, she knows how to think for the pada, and therefore comes up with the solution which are implemented locally. So this is the portrait of a future DAI we see as a guide to the village with help of many other programs which can be implemented once the trust is built up like this.
So the project visualizes DAI not just as a health practitioner, but as a social leader who actively participates in shaping the future generations of the tribals.
सुवास,